Could inflammation be messing with your mood, even though life seems to be going okay? Well, let's explore why this could be and the hidden link between inflammation and mental health issues like depression and anxiety. Hi, I'm Dr. Patricia Mills, holistic medical doctor with a root cause approach to health and hormones, and welcome to the Wild Wisdom Show. Today, we're going to be talking about depression, anxiety, and inflammation, the root cause that you need to know now. So when talking about inflammation, it's important to understand what exactly it is that we are discussing. Inflammation is your body's natural healing response, and it's very helpful in the short term. Like if you cut your skin, the body sends the immune system to the skin, it gets red and swollen. It's painful for a period of time while that immune system is working, and then it defeats any of the invading organisms that are there, maybe trying to establish an infection. It calls in the healing factors so that your skin can heal, and over time, that injury goes away. But when we have chronic inflammation, long-term inflammation that happens either on the skin, but also importantly on the inside of the body, so it could be in the gut, in the tissues, in the joints, in our organs that produce hormones, even in the brain, that inflammation, low grade, continuously without going away, can be extremely harmful and has been linked to conditions not only in the body, but also in the brain. And so chronic inflammation equals problems with your mood, and that can manifest with low mood, irritability, some depression, anxiety, all the way through to major depressive disorders and anxiety disorders. So the way that this happens is that inflammation in the body and then in the brain can interfere with how your brain regulates mood. Studies show that many people with mood disorders, as mentioned, and not only just anxiety and depression, but all the way through to bipolar disease and schizophrenia, it depends on how severe the inflammation is and what pathways are affected. These individuals, when they study them in research, they have higher inflammation markers in the body and the brain, and it can be one or the other or both. Now, why would someone develop a problem with chronic long-term inflammation inside of the body? Research is showing that it can be due to an inflammatory diet that causes inflammation locally in the gut and then through the tissues of the body that are being exposed to the molecules from this diet. And then that inflammation can actually trigger inflammation in the brain. Poor sleep can trigger inflammation. Stress has been proven to do so. Certain toxins, it can be from our food, from our drinks, from our environment, and a sedentary lifestyle. So under-exercising can also be a root cause for chronic inflammation, as can over-exercising, but that tends to be more rare. However, it is something that can happen. What's interesting is that if you get inflammation in the brain from these root causes, that causes neuroinflammation, so neurological inflammation in the brain, and that affects the regions in the brain that are tied to mood, motivation, and emotion. And the immune system in the brain has many different names and functions, and one of them is the microglia. It's a certain part of the brain that's involved in the immune regulation of the brain. And when the immune system gets activated, which then causes the inflammation, that's when mood shifts start to happen. So these brain immune cells get overactive. They start to produce chemicals of inflammation, and these chemicals can be cytokines and fancy names like interleukin 6 and TNF alpha, HSCRP, and other more brain-specific inflammatory markers, and mood change can follow. And one of the things that inflammation causes is a decrease in the production of your feel-good hormones like serotonin and dopamine, and it can increase the, I don't like to call it bad hormones, but hormones in the brain that when inflammation causes increased production of hormones like glutamate in the brain, then that causes problems with mood disorders as well, because glutamate is too excitatory. It's too exciting for the brain, and it can actually overactivate other areas of the brain, and that can be damaging. Not only does the chemistry in the brain change, but brain scans also show changes in the function of brain areas. So brain scans don't lie. When we take people with mood disorders and we do brain scans of these individuals compared to healthy controls, many of them show changes related to inflammation in the brain. So the good news is that if we can target that inflammation, we can actually improve the mood disorders all the way through from that low level irritability, low mood, the mood swings, all the way through to major depressive disorders and other more significant health conditions. So can inflammation cause depression? That seems to be something that some people have a hard time conceptualizing, but the research is pretty conclusive. We can get depressed from inflammation in the body and the brain. So when they've done studies on animals, because it's not ethical to induce inflammation in a human and watch what happens, but when they've done study on any other animal model, when they cause inflammation in that animal, they start to develop signs and symptoms of depression. And in humans, when they've done studies looking at, does inflammation cause depression and depression cause inflammation, it's bidirectional. When humans start to get inflamed over time, they develop mood disorders. Not all of them, but many of them do. And when a person has a mood disorder, they actually can get more inflamed. So that is called a bidirectional relationship. It goes both ways, and it can cause a very vicious cycle. So what we need to look at now is anti-inflammatory treatments. And this is where we get into new hope, so to speak. We can look at supplements. Certain medications may be helpful for some people that have been shown to reduce inflammation. But very importantly is addressing those root causes, what happened in the first place. If you have an inflammatory lifestyle, unknowingly engaging in certain nutrition, certain habits, things that are causing inflammation to occur in your body, we need to reduce those. We need to target those. So that's with an anti-inflammatory diet, looking at improving sleep habits, getting better deep sleep, supporting detoxification pathways for less inflammation, addressing stressors, both physical and emotional, and all of those things can contribute. And I'm going to give you some really great resources at the end to learn how to do that on your own. Now, some people might say, well, how powerful would an anti-inflammatory diet be for reducing depression? And actually, did you know it's extremely powerful? In fact, there was a study published in 2017 called the SMILES trial, SMILES trial. And they actually took people with moderate to severe depression who were being treated with an antidepressant. There was partial response or not enough response. They wanted additional improvement in their depression. So they did a trial where they basically divided the group randomly into two groups. One group was given just social support, so touching base with the individuals on a regular basis. The other group, however, was given nutritional support. So they were taught how to do a Mediterranean style diet. And we're going to talk about what specifically they focused on and what they eliminated. But interestingly, this Mediterranean style diet significantly reduced depression symptoms and even caused remission in many of these people, meaning that they were cured, so to speak, on the combination of the medication and the diet. So what did they eat? They ate a lot of vegetables. So very, very high in anti-inflammatory vegetables. Vegetables are very powerful anti-inflammatory foods. And so when you're trying to treat inflammation, you're basically doing a modified Mediterranean diet where you're really upping your vegetables. And other research has shown that in order to really reduce inflammation, you're looking at between 6 to 9 servings of vegetables a day. So if you're eating 3 meals a day, that's anywhere between 2 to 3 servings of vegetables with each meal, including breakfast, which is actually a game changer for many reasons. And I've gone into this on many other episodes, but for this purpose, it's really to reduce inflammation related to brain inflammation related to depression. They also had fruits. So instead of eating processed sugar, they had sugar from natural fruits. And these were whole fruits, not smoothies or fruit juices, or fruit roll-ups, just the whole thing. Legumes, which are beans, high in fiber, whole grains. So when I say whole grains, I'm thinking of things like quinoa, rice, teff, millet. I'm not referring to bread made from whole grains or pasta made from whole grains. Although you can get good quality options, you want to minimize the refined flour products and maximize the whole grain products. The other things focused on are fish and olive oil, which is very anti-inflammatory, both of those foods. What they avoided was processed foods, so ultra-processed foods, convenience foods, even if they're labeled as healthy, like granola bars or protein powder and those sorts of things, those are technically processed foods. They were advised to focus on whole food products. They were told to avoid or minimize sugary snacks, sugary drinks, and ultra processed oils, which are vegetable seed oils such as canola oil, corn, soybean, safflower, sunflower, all of those ultra processed oils, and focus on more of that olive oil. It's not ultra processed. You can actually squeeze the oil out of the olive. So it's mechanically pressed, or it's called cold pressed or expeller pressed. And that olive oil is very, very clean and very anti-inflammatory. What you're looking for is one called extra virgin olive oil, because if it just says olive oil, then they used other methods like chemicals to extract that leftover oil from the bits and pieces left over after cleanly extracting the extra virgin olive oil. The results of this diet from the study were amazing. The people in the group that were taught about doing the Mediterranean diet with the modifications discussed, they had a 32% remission rate, which is incredible, which means that when you do questionnaires for depression, and the higher the score, the more depressed you are, the lower the score, the less depressed you are. And if your score is low enough, you're said to be in remission. So you no longer have depression. And these individuals going into the study, they were on medication, but they still had a diagnosis of depression. And after the study, 32% of the people in the nutrition group had a remission. So they no longer met the criteria for depression. And this is compared to just 8% from the social support group. So yes, getting some touch points with social support, someone calling you to check in and see how you're doing, that can be helpful, but it's not nearly as powerful as an anti-inflammatory diet strategy. So diet works both on its own and with medications. The diet added that extra power to the treatment. So it can be used as a standalone, it can be used with medication. Whether or not a person can be treated without medication depends on a conversation with the doctor and seeing how severe is the depression. Are there any suicidal tendencies? Do we really need to act fast? Because the medications and the diet, they both can take some time to work. Antidepressant medications can take about 4 to 6 weeks to work. And the diet is the same thing. It can take about 6 to 8 weeks to start kicking in. Oftentimes research go to 12 weeks. And so you need to give it enough time and be consistent and persistent and have a discussion with your healthcare provider in terms of the medication. Do you need to be on it? Can you reduce the dose? Do you do it with the diet on its own? That's a conversation between you and your health provider. And for you to also feel into and determine for yourself, what do you need now? What can you do now? And the interesting thing is that blood tests may miss brain inflammation. So you can do blood tests for inflammation. And I've covered in a previous episode, and you can go use the search bar on my YouTube channel. And that Dr. Patricia MillsMD is the name of my YouTube channel. And you can search the playlist for inflammation or my inflammatory markers video. You could actually have a completely normal blood work panel with no evidence of inflammation in the blood, because the inflammation is in the brain. And all of those tests used to test inflammation in the brain, those are research tests. They're not available to doctors to use in their clinical practice. They're only available to researchers. They're a bit more invasive. They're more expensive. The government can't pay for it, and it may not be worth the risk to put everyone through these tests. So when a person has a problem with a mood disorder, it's worthwhile to explore the anti-inflammatory aspect of treatment, both from a medication perspective as well as a lifestyle, or at the very least the lifestyle part. But it's very hard to out-medicate a inflammatory lifestyle. So in my opinion, the foundational thing is the lifestyle, and then you can add on the medication as needed depending on the severity of the depression. And sometimes people get so depressed that they don't have the energy or motivation to do the lifestyle. And in that case, the medications can be useful to get out of that vicious cycle, because once you get inflammation and that increases depression, that depression makes it harder to engage in the lifestyle. You tend to eat worse and sleep worse, and then that worsens inflammation. So that vicious cycle can be hard to pop out of. So sometimes the medication can be that thing that you need to pop out of that cycle, get the energy and the motivation to do the lifestyle changes, and then come back to the medication in the future and say, do I need this now? Or am I improved enough that I can, with my prescribing health provider, decrease the dose and see how I respond to that? Maybe the lifestyle now is enough. Addressing the root causes is enough. So the question is inflammation the missing piece for your mood disorder issues with depression and anxiety? Because when you treat inflammation and you adopt anti-inflammatory lifestyle strategies, mood disorders can improve and significantly, whether you're on medications or not. So if treatments haven't helped enough, or if you want to explore options beyond treatments, then it's time to consider hidden chronic inflammation in the body. And an anti-inflammatory lifestyle may be your path to better health. You deserve relief, and understanding inflammation brings you hope and real root cause healing. So please, at the very least, go to my YouTube channel, Dr. Patricia Mills, MD, check out my inflammation playlist. And you're going to see that all of the videos I've made on the topic of root causes of inflammation, how to detect it, how to know if you have it, and solutions and strategies are all placed there and will be placed there in the future as I make more videos on this very important topic. So if you enjoyed this video, please subscribe to my YouTube channel. That's the best way to support the Wild Wisdom Show. Save this for future reference and share. Sharing is caring, and you never know when someone's going to benefit from this wild wisdom. Thank you for joining me. Hope to see you next time. Have a wonderful rest of your day, evening, or night, depending on when you catch this. Bye now.